But one of the happiest moments of my life was when I came into your office with that horrible headache, and I could barely look straight ahead of me. I had such a terrible episode happening, and you gave me a series of at least 5 injections, one by one, taking different nerves offline with your nerve block injections, and 20 minutes later, the headache was gone.
Yeah.
And I thought to myself, oh my gosh, this is real, and this is going to work.
Yeah. I've had a number of medical students that I've lectured to. I've had a few visiting surgeons from around the world. Spain recently. We've got somebody from Korea, somebody from Australia, another person from Japan coming to visit me in 2023. And, what you're describing is something that I see in my office. Very thankfully, I'm incredibly grateful for it multiple times a week. And I will tell you that type of response literally never gets old. You have patients walk in and their eyes are closed and they ask you to please turn down the fluorescent lights because unfortunately all the lights here, well, they're not fluorescent, they're LED, but they look like fluorescent lights. And, they're bothersome to patients, and you have a husband because women suffer 3 times as often as men, although obviously there are plenty of men that suffer this problem as well. But, oftentimes it's a husband kind of leading his wife in, and they sit down and she's kind of looking like this and barely talking. And after you do this series of shots, once you're done with your last 1 or 2 and you walk in and the patient is, they're kind of looking ahead almost incredulously and their eyes are open for the first time. And the husband is looking at the wife and he's in tears and she's like, I can't believe it. Like, this doesn't hurt to just kind of be in the room. You turn on the light, nothing happens. And, the husband's crying and saying, there's my wife. I haven't seen this in 27 years or whatever it is. And, I've had a couple of the visiting surgeons cry too. It's really a powerful moment. And I think it speaks to so many things. Number one, just how amazing it is to have just a moment of relief. And I think that so many of these patients, they're literally suffering 24 hours a day, 7 days a week. What you or I would, in most cases, say is, I should speak for myself because you've really been through the ringer in your particular case. But I think what most people would put them, in bed, these people kind of live with at baseline. And then it's really only when the headache's an 8, 9, 10, which would put most of us in the hospital, do they say, hey, this is really bothering me. To have that whole phenomenon gone, even if it's for an hour or 2, is really, truly remarkable. And the other part of it is that it is really a great harbinger for a good result from an operation done correctly. And the data continue to vet that. And when I see those patients in the office, I had a call today, 3 months after an operation on all the frontotemporal nerves. And you can tell within 10 seconds of being on a video chat with someone, you look at them and I'm like, how you doing? And they're like, hi, how you doing? How are you? And there's a smile there and the eyes are open and it's great. And it's completely different, the affect, than it was when you first met them. And they were like, hi. Yeah. And it's going to be a good conversation. So, I think you've hit the nail right on the head, and I'm obviously glad you've had the experience that you've had. But it's I will tell you, it's literally the best thing. It's why I wake up and go to work in the morning, because if I know I have somebody that's coming in and I just had a good sense on the video chat beforehand that I'm going to really be able to help this person, it's really a wonderful place to be.
So tell us about some of the surgical results you're seeing, especially long term. Give us maybe a few of your favorite stories, the trophy cases.
Yeah. So one of my favorites. Well, you have yourself because I think you've done so many amazing things since your headaches have been so much better, including and especially talks like this and your podcast, which really provides a lot of information that helps so many other people. So you are one of those really great success stories. I have another young gal, is a sports fan myself. I do a lot of Ironman, and she was a on the U.S. Olympic ski team. And, after one too many falls, basically couldn't even hold a small purse, much less ski or engage in any sort of physical activity. And she was kind enough to come in about a year after her operation, and we have this lovely video where she again breaks down talking about how she was able to dance at her wedding, something that she couldn't do. And then you have all of the sort of almost like average Janes and average Joes. I mean, we have people come in and they say even simple things like, look, I have a 5-year-old daughter that I'm able to play with now. I am a much nicer, more involved husband, and I'm able to help my wife, who really took care of me for so many years. I can kind of give that back. I've had there's another patient of mine who started a small foundation to help. She's a relatively wealthy gal, but again, to her credit, said, I realized a lot of people might not have access to travel to see doctors because there aren't as many of us as I wish there were, although our numbers in this small society are growing every year, which is really encouraging. And we actually had an international symposium just last month out of South America, so people everywhere are really interested in this. She helped start a small foundation to help defray costs for patients having to travel to have their surgery. And I just think all of these little stories, they're all so unique, they're all so heartwarming, and I could sit here and talk for hours about all these individual patients, but they're all really great. I mean, there's another gal who has a 16-year-old son, and I believe she's in her early 30s, but basically came to see me as a headache patient because she was assaulted by her now, thankfully, ex-boyfriend. And I believe this gentleman, as he should be, is probably in jail, but she couldn't work anymore, couldn't support her son. She didn't have a lot of family help, and again, as a result of the operation, she is now working full-time. Things are just that much better, both for her as a mom, but also for her personally. So, you could go on, and it's just literally the most wonderful experience to be able to do something like that for anyone.